Well, I think the first thing I want to talk about is knowing what not to do when you have financial problems, particularly, well, any kind of financial problems. See, what we do is we run to Google. Now, you got to realize that Google is there to make money off of you. And if you don't have money, then you can't really take advantage of Google because everybody there wants to get money from you. See, here's how our economy is set up. 2/3, or actually 60%, is capitalism. This is Google. So everybody in there in Google wants to get money from you, but your financial trouble, you don't have money. So you have to go to the other side of the equation, which is only 40%, but that's still big. And that's government programs and nonprofit organizations that give you money. See? Google wants to get money from you. These people want to give money to you. How do you find them? Okay, here's a listing I got, particularly for healthcare. So if you have healthcare bills and don't know what to do, lots of help out there, but it's not in Google unless you know the exact name. But if you put in, healthcare bills, you'll get 200 million websites and you won't be able to find them. You'll call some people and they say, yeah, it'll cost you money. No, you want to go to the community economy, what gives you money and help. This is like your fire department. Come and, put out your fire for free. Well, they're putting out your financial fires for free, too. Now, okay, here's the first place. It's called gooddays.org, C-O-R-G. O-R-G and G-O-V are the websites that give you money. And what they do, listen to this, even if you have insurance, and you can't pay all your, what you have to pay, even though you had health insurance, they cover it. They give you a grant to give you the money to pay what your insurance company doesn't pay. And listen to this. It's for incomes up to $160,000. Now that, you thought it was only for poor people, did you? Nah. Okay, that's just one. Let's go to another. PAN Foundation. Now this, they have a program that helps you for paying prescription drug out-of-pocket expenses. Now they do a lot of stuff, and this is one of them. So they cover out-of-pocket expenses for prescription drugs. They give you a grant to pay for your prescription drug. So, you go there and you have some of it's paid for, but the rest you have to dig in your pocket. You got pockets there to pay for. Okay, here's another one. Co-pay relief they have. So if you go to the hospital, you go to see your doctor, and there's a co-pay, you got to pay $150, okay? They have grants for that, and that's patientadvocate.org. See, it's all .org. The same way, that's panfoundation.org, and this one's patientadvocate.org. Okay, so that's for co-pay. Okay, now this is a very important thing. This is one-on-one management of your bills. So you get all these goddamn bills, if you were in the hospital or something, it's overwhelming, right? You don't know. Okay, you contact these, so patientadvocate.org. They help you one-on-one, and you can see the videos of the people that help and how it is. Man, it's just a wonderful service. It's all for free. You never have to pay, remember, because that's a .org, not a .com. Okay. Also, how about what happens if you're denied? Okay, you're denied, treatment. They'll fight for you because you were denied treatment. Okay, now that's sort of neat. Okay, that's patientadvocate.org. Insurance denials and appeals. Okay, here's another neat thing. They have a financial directory there. You could find over 50 to 100 local sources to pay living expenses while you're sick. See, there's nonprofit organizations that try to help people in this country. We're not all just trying to make money off each other. There's people out there that are really trying to help people. And these are nonprofit organizations. So they've collected a database. If you're sick in bed and can't do anything, they'll have to pay those living expenses. So you could go there, choose one. Do you have insurance? Yes or no? What is your age? Okay, let's say we have no insurance. Okay, no insurance. What is your age? well, 65 and up, that's me, but you could be any age. Residential state, okay, let's just put Colorado. Medical diagnosis, cancer, you have a whole list of things. Let's say it's cancer. Assistance, type of assistance, living expenses. Well, they have prescription drugs there, they have emotional support, education resource and everything, but let's say living expenses. You can't get by because now you're in bed. Okay, what do we have here? We've got search. Maybe we'll search. Maybe we won't. Oh, here it comes. Okay, wow. You know how many? We have 102 financial sources for people that are in Colorado and can't pay their living expenses because they're sick. 102. How would you know that? Okay. Now they have another program here for caregivers. Okay, if working while being a caregiver, okay? So this is not only for the sick person, this is your rights as a caregiver to take care of a loved one because you can't go to work. So they tell you the laws, they tell you the programs to get income for that and things like that. Working while being a caregiver, okay? And then here's another group, support groups. Now this is interesting because it should be. So any kidney and bladder problem support group. I mean, you put in the name or the interest by interest, allergies, aging well, asthma, anything. You can put blood disorders. You find groups, and it tells you, like for bones, joints, and muscles, okay, there's 13,000 people in a support group. You want to learn from people who've gone through what you've gone through. And that's using support groups. They know about programs and things like that. That's the way you learn. That's the way you grow. You don't grow by just asking Aunt Telly what she did. No. You go to people who are involved in it today, and they're 2 months ahead of you or 2 years ahead of you. And look at, for lung health, 5,000 people that you could contact. Bronchitis, all that kind of stuff. It's a wonderful allergies. You can't solve them? Well, there's 960 people working on that problem too. That's who you want. And they're free. Everything I give you is free. And then we have other organizations that do this. Most of that is the PAN people, PAN Foundation or Patient Advocate. But here, there's 1, 2, 3, 4, 5, 6 more nonprofit organizations that provides free services like this. So if they don't help you, you keep going. One is called accessiahealth.org, tafcares.org, cancercare.org, healthwellfoundation.org, lls.org, rarediseases.org. Contact each one of those and see what kind of similar services they have. See, it's going to take work on your part. There's no magic website that you're going to get it all. No, you're going to have to do the work, roll up your sleeves, and do it. The help is out there. Remember, 40% of everything in America gives money away free. 40%, but they're not in Google. So the one thing I hope you learned in this video is the first thing not to do, don't go to Google unless you have lots of money. And I've been helping people for 50 years doing this, so I plan to do it for another 10, 15 if I get really lucky and stay healthy. So let me help you too.